skin growths that look like warts can vary significantly in appearance and causes. Some are benign and common, but others can be skin cancer and dangerous. Therefore, accurate diagnosis is crucial. I will tell you about top 7 wart-like lesions, how to differentiate them, and how to treat each one. First and most common such skin growth are common warts. They are caused by virus, human papillomavirus, which causes skin thickening called hyperkeratosis. We see it as a skin growth, usually several millimeters, and flesh-colored or grayish. Warts commonly has black dots. They are actually thrombosed capillaries. They commonly appear on hands, feet, and other areas which are prone to minor traumas. The warts can be painful, especially when you pressure them, especially on feet. Human papillomavirus infection is spread very easily. Skin-to-skin contact or with contaminated surfaces when a person has minor trauma or microabrasion. The virus disrupts the normal cycle of the cells and leads to uncontrolled and rapid proliferation of keratinocytes, and we see it as a skin growth. 80% of warts will resolve on their own within 2 years. The occurrences are possible in around 30% cases. Effective treatment for the wart is topical salicylic acid, which is applied daily and can take several weeks to months, or cryotherapy. Liquid nitrogen application every 2-3 weeks until resolution. Although risk is low in immunocompromised patients, long-term warts can increase risk of malignancy. The second most common skin growth is seborrheic keratosis. It is the most common skin lesion in elderly individuals. They appear as well-demarcated scaly or waxy plaques that look like they could be peeled off the skin surface. Can range from light tan to dark brown or black, sometimes with variegated shading. They are round or oval, sharply demarcated, slightly elevated lesion with a warty surface. The size usually is less than 2 centimeters. After 40, seborrheic keratosis is common, and after 60, almost universally common. They can appear anywhere except the palms and soles. Dark irregular border seborrheic keratosis may look like melanoma. That is why biopsy is required for diagnosis in suspicious cases. Also, seborrheic keratosis may look like solar lentigo, which is also called liver spots or age spots. They are flat and pigmented spots due to sun damage, different from seborrheic dermatitis. They are not raised or scaly. Seborrheic keratosis usually is a cosmetic problem and does not have risk of malignancy. Normally, seborrheic keratosis develops gradually over time, but can occur overnight also. However, a sudden and explosive eruption of many new seborrheic keratosis, particularly if they are inflamed, itchy, or appear in unusual locations, can be a sign of internal malignancy and requires medical attention. Typically removed via cryotherapy, curettage, or shave excision if bothersome. Seborrheic keratosis is not infectious and is not transmitted from one person to another. Usually, it has genetic predisposition, possible involvement of local growth factors or mutations. The third common skin growth is skin tags. They are small, soft, flesh-colored or darker skin growth, often appear on neck, armpits, groin, eyelids, and under the breast. They are connected to the skin by a thin stalk. Skin tags are also extremely common. It affects almost 50% of adult population. The causes of skin tags are friction or skin rubbing against skin, more common in folds of skin. Risk factors include obesity, type 2 diabetes, pregnancy, and genetics. Skin tags are highly associated with insulin resistance and metabolic syndrome. They are harmless, no malignancy risks. Treatment is possible for cosmetic reasons. Excision, cutting, or cryotherapy is common. The fourth common skin growth is moles. Nevi, they are clusters of pigmented cells we call melanocytes. They occur due to genetics and sun exposure. Most moles appear on childhood and early adulthood. This person has at least several moles. Nevi usually harmless. They can be flat or raised, smooth or rough, and different colors from pink tan, brown to black, usually round or oval, and usually less than 6 millimeters. Sometimes they can be associated with skin cancer called melanoma if they are multiple, if they are atypical, or dysplastic means larger with irregular border, asymmetrical color variation inside mole, and if they evolve over time. Also congenital moles periods present at birth periods may have a slightly higher melanoma risk. And fifth common is dermatofibroma. It is a benign firm raised bump that is usually reddish brown or brown in color. They often occur on the legs and arms and may feel like a button under the skin. Common, but less so than moles or skin tags. Estimated prevalence is around 3 to 11% in the general population. Now, let us say skin cancers, which can mimic skin warts, and in which cases we should be careful and attentive. The first malignant tumor, which looks like warts, is squamous cell carcinoma. Generally, it is the second most common malignant skin cancer. Usually happens due to cumulative sun exposure, ultraviolet radiation. If left untreated, it spreads into the body and gives metastases, but not very common. The skin growth is wart-like, rough, raised, scaly bump or nodular. Color can be flesh-colored, pink, red, or sometimes yellowish-gray. Surface is irregular, cauliflower-like or scaly. May have crusting or bleeding. Common locations are head and neck, hands, and forearms. We saw on the scalp in balding individuals. Sometimes on legs, hallmark of the condition is a new lesion that does not heal, like a normal cut or scratch, can grow more quickly than benign lesions. Firm to touch, can be painful, usually diagnosed after 50. This tumor is highly curable if detected and treated early. Cure rate is more than 95%. Metastasis is uncommon for early cases, but the risk increases over time.
The second important lesion is actinic keratosis, which is a precancerous lesion, usually resulting from chronic ultraviolet exposure, considered the earliest stage in the development of squamous carcinoma. Not invasive cancer, but have the potential to transform into SCC if left untreated. It appears wart-like, rough, scaly patch or small bump. Feels gritty like sandpaper, often easier to feel than see. Typically small, often less than 1 centimeter. Extremely common, especially in fair-skinned populations. Millions are affected. Most common precancerous skin condition. Common locations are sun-exposed areas. Hallmark is they are characteristically scaly and rough, more like sandpaper than the typical rough surface of a wart. Often flatter than warts, although hypertrophic actinic keratosis can be more raised. Actinic keratosis often occur in multiples and over a wider area of sun-damaged skin, most common in adults over 40 with increasing prevalence with age. It is curable and treatable. Cryotherapy and topical medications like creams like 5-fluorouracil, imiquimod, inganomebutate, or diclofenac periods for field treatment of multiple AKs or larger areas periods.
The third disease is Bowen's disease, which also called squamous cell carcinoma in situ. Its appearance is persistent, well-defined patch or plaque, usually red, pink, or brownish. It is patch-like, more often present as a flat patch or plaque, rather than a distinct raised wart-like growth. Characteristically scaly or crusted, may be less rough and cauliflower-like than a typical wart. Typically grows slowly over months or years. Typically diagnosed in older adults, usually over 60 years old. It is highly curable as it is non-invasive. Cure rates are excellent with appropriate treatment, often approaching 100%. Another important tumor is basal cell carcinoma. It is the most common type of skin cancer, almost always caused by ultraviolet radiation exposure, generally slow growing and less likely to metastasize than melanoma. Nodular BCCs, especially early on, can be raised and skin colored, potentially resembling a fleshy wart. However, the classic appearance is more distinctive: pearly white skin, colored pink or translucent. They may have small blood vessels periods, telangiectasias periods on the surface. It is the most common type of skin cancer worldwide. Millions of new cases annually. Common location is sun-exposed areas, most commonly face, nose, ears and neck. Most commonly diagnosed in people over 30, with increasing incidence with age. This cancer is highly curable if treated early. Metastasis possible but rare.